عشي بلادي عاش اتحاد إماراتنا عشتي لشعب دينه الإسلام هديه القرآن حصنتك بسم الله يا وطن بلادي 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 حماك الإله سرور السماء أقسمنا أن نبني نعمل نخلص مهما عشنا نخلص دام الأمان عاش العلم يا إماراتنا رمز العروبة كلنا نفديك بالدماء نرويك نفديك بالأرواح يا وطن.
أعزائي المشاهدين، كما عودناكم في برنامجكم الأسبوعي برنامج إماراتي أن نستضيف لكم خيرة من دولة الإمارات العربية المتحدة. ولهذا الأسبوع قصة نجاح حدثنا من الهند في عام 2015 وبدأت الحياة العملية في عام 2019 في إمارة دبي. الدكتور شانكر المدير التنفيذي لمركز OpenMinds للأمراض العقلية. يسعد مساك دكتور شانكر. Good afternoon.
Good afternoon. Thank you so much.
At the first, we would like to know more about Dr. Shankar, from where he came and what he studied before when he started his own business in UAE.
First of all, thank you so much for your team, for having us on your TV.
Thank you.
I'm originally from South India, but I moved to United Kingdom for my higher training in the field of psychiatry back in 2003, and I continued my journey there for 13 years. I completed my training and became a consultant psychiatrist.
Great, mashallah.
Then in year 2015, I moved to Dubai. I always consider UAE as my one of the it's like a homeland and residence for me. My brother has been working here for quite a number of years.
MashaAllah.
So because of that, I have been regularly visiting to Dubai as a visitor. So I was very much impressed about the multicultural environment here and the support that's being offered to the residents here by the highnesses and rulers of this country.
Right.
I'm very thankful to all of them, for providing this support to the expatriates here.
Great.
And all this influenced me really to establish this
Your
service
own
for
center.
them. Absolutely.
In 2019 we start our own center, but we was have, I'm sure, a vision. Can we know your vision for this center when you start?
Sure. When we first started, I think I and a couple of my other colleagues, psychology colleagues, we both were there, and now with God's grace, I think we have around 10 clinicians. We are a dedicated and established center only for the field of psychiatry, psychology and neuroscience. So we would like to have a vision to have a quality centered and team working model for the clients going through the mental health issues. Our vision is to have an integrity and collaborative model which is very much recovery focused. That means a client should not feel that they have to use the medications in this field for their lifelong. With the support of the various specialties, I think I'm sure this is very much possible for somebody to recover from their condition. So this was my vision to establish OpenMinds Centre.
To give good quality of service, we must have a professional team who will support our success. Can we know how you select the team who work with you today?
Absolutely. Apart from the qualifications and their skills, I believe that every clinician should have a team working enthusiasm. They should not be working isolated by themselves, seeing the clients. Always they should have a collaborative approach, with other team members. Could be between a psychiatrist and a psychologist, or it could be with a neurologist or the internal medicine physicians or a nutritionist, so on and so forth. So I always ask my team members how comfortable they are to work in a team rather than isolated by themselves. And I have to be very honest, and I'm very fortunate to say that all our team members come from same sort of vision and also same sort of ideas about the team working. That is the reason why we are able to deliver this quality patient-centered service. And I meet all my team members one-to-one to discuss combined cases between myself and the psychologist as a clinical meeting once a month, so that we discuss and we both are in the same page of the treatment. So I provide more from a medical side of things, and they provide more from a psychological side of things. And the client is very much satisfied that we both are working on the same model.
Today we have many sections in Open Minds. Can we know more what you are serving exactly, and how many sections we have in the center?
Sure. To start with, OpenMinds is both a DHA, Dubai Health Authority, and a CDA, Community Development Authority licensed. We provide services to children, adolescents or teenagers, adults, couples, and also senior citizens. So these are the various age groups we provide. Coming to the sections, we have a child section wherein we have a child psychologist who are experts in assessing the conditions. Like for example, somebody going through a simple condition like an anxiety or depression during the childhood age, or the depression during the teenagers. And we have assessments for developmental related issues like having speech delays or anything of that nature. More recently, very fortunate to have a child psychiatrist also on board, who is an Italian national and who became part of our team. So we are planning to develop further with the combination of both child psychology and psychiatry to have a dedicated child service. Of course, we have it now, but we want to reform it more. In addition to that, we provide services to all the adult patients. Where we have general psychological therapies like cognitive behavior therapy, psychodynamic therapy, dialectic behavior therapy, and more recently I'm fortunate to say that we have another doctor who is expert in EMDR, which is a very specialized therapy for people who have gone through traumas, something related to their childhood or the families or those who are involved in war areas. This is a specialized therapy for the trauma, and she's part of our team now. So we have this service, and also we have an exclusive family service wherein it is for the marital or couple counseling. This is for somebody who is going through severe issues with the marriage, and the couples wants to get some sort of support or counseling. We have a dedicated doctors dealing with that. And last but not least, we are trying to collaborate with various corporate organizations for corporate wellness programs like employment assistance program. Employment assistance program increases the productivity of an organization and also help to increase the satisfactory levels of the employees in an organization. And these days, because of the COVID situation, stress is there everywhere. So we need some sort of support to the employees. So we are trying to get a tie-up with those also. We are also trying to collaborate with the schools and the education institutions. We are professionals who are working with the schools so that the children or the students going through the common mental health issues like stress or any anxieties or parental concerns leading to the issues in the children. We are trying to collaborate with such schools so that they come forward to take help from those services. Yeah, these are in the various regions we are trying to really cover. And last but not least, my next aim is also to add a neurological service. So we are neurosciences. So I think a neuroscience service without a neurologist is always incomplete. Maybe in the very near future we'll be able to get a neurological service under our board.
Wow, great. Yeah. Can we know how we support the special needs if we get any service to serve them?
Yeah, absolutely. Thanks for asking this question. With regards to special needs children, we have all the required assessment tools which we procure from various organizations of the globe. We do assessments for somebody going through autism. Yeah, we have professionals who are experts in that area. We also do a specific test called as IQ test for children going through various conditions or the issues having the reading difficulties or learning difficulties. In the future, our goal is to increase or have more awareness through our collaboration with the school, so that the parents will be able to come forward to take the help. And also the next area is to add on the therapies required for these children, like speech therapy, occupational therapy, behavioral therapy, so on and so forth. At the moment we are just doing the assessment that is required for these children, but in the future we definitely have the vision to get the therapies or the services required for these children for treatment.
Did we try to reach some center for the special needs from our office, or to send our doctor to there?
Yeah, so basically our doctors have got links with some of the professionals working in other centers. So they usually refer the children if they require any therapies that needs to be started immediately, because we don't have those therapies at the moment, but we don't want to delay the treatment for such children. So we instruct the parents, we advise them to go and see this particular doctor.
As what you know, Dubai, we have a lot of tourists. They come here and for the medical also.
Yes.
Can we know how we support the tourists, and maybe they need a long treatment, but how we make it short or fast, or how we can support them maybe online?
Yeah. After we are hit by the COVID situation, we started doing the online consultation through Zoom, for various clients who are going through the issue. They're not able to travel, they're not able to come out of the homes because of the concerns. So we started doing a Zoom consultation for such one. And regarding the tourists in specific, yes, I think very regularly we get tourist clients coming to see us. For example, a lot of clients who they have the family members, they come to visit the expatriates here, and they get some amount of medications from the home country, but after they come here they are completely exhausted with the medications. They need somebody to prescribe that. We support such clients by their seeing them on Zoom or seeing them here face to face here in the center. And regularly we get the tourist, as we prescribe the medications as per their condition. If somebody who is very stable in the condition, we tend to provide more amount of medications. If somebody is not stable, yes, we have to be vigilant and we have to be careful about giving them a lot of medications.
With COVID-19, we saw many people, they are very nervous or they are very stressed. How he advised them with this situation today, from your experience, Doctor?
Sure. See, COVID-19 is definitely, this is a pandemic which really shook the human mankind in other ways, affecting their lives in various domains. Definitely it really led to some sort of increased heightened stress. The reasons being the clients or the people in general, they started living in quite a artificial environment, being at home all the time, less flexibility, and that led to increased stress and also sometimes the relationship issues between the couples, so on and so forth. And we advise them to have a clear communication when it comes to the parents involving the kids. Should have a clear communication that what can be expected from the parents during the situation. Maybe the kids have got a lot of expectation from the parents that they need to go out or they need to involve them in all the activities, but it is not possible. So a clear communication which reduces the stress of the kids and also the parents, it's very important. We advise that to the parents. Coming to our own clients, of course it's not natural, they cannot go out, but again, wearing the masks, some of the clients, they were able to really go out for walking and doing the jogging or any regular exercises.
Right.
That has to be continued, because if not, the stress levels may further increase. Having a regular meditation or some sort of breathing activities, through the online apps. There are many online apps available. Spending 10 or 15 minutes on every day was very helpful. And monitoring any warning signs for depression or a panic attack or severe anxiety, should be carefully monitored. This is what we educated all our clients who are coming, so that they can take the help immediately. And we don't want the things to get very complicated, and the risk issues come into picture. Before that, the clients should be taking the help. So these are the various advices. Last but not least, as I mentioned to you, online telephone consultation, Zoom consultation is offered to all the clients. So that they can really reach out to us very quickly.
Sheikh Muhammad bin Rashid, he mentioned in my vision book, we have always to be on the top and to be number one. Today, if I ask you, Dr. Shankar,
Yes.
1 year you already in UAE, or around 2 years you give your service here.
Yes.
What we can see in your Open Minds Center number one?
I'm proud to say that I think, even if you are providing a service to very limited number of clients as of today, of course, compared to what we were last year, I think our client number has definitely increased. Even if that number is not very high, but I am very proud to say that we are providing a quality service.
Right.
We are very patient-centered, and we have a lot of services which are not actually written maybe on the books or on this one, but again, a lot of things are going on behind. Like, for example, the collaborative approach between a psychiatrist and psychologist. That is something very, very unique. Often, the psychiatrists and psychologists or the professionals, they are busy seeing the clients back to back every day,
Right.
But having a clear communication between these two professionals is very, very important. Likewise, having a communication with the physicians, it's also very important. So we are able to do that. And the second thing is, we are almost able to really offer a number of therapies. As I mentioned to you earlier on, we have therapies designed for each and every category and domain.
Right.
Of course, there is always a room for improvement. And also we are multicultural, multilingual. We have psychologists who speak Arabic, French, and we have somebody who speaks Italian, native English, and we have psychologists who speak some of the Indian languages like Urdu, Hindi, and South Indian languages. And we are multicultural, and I would say that these are some of the developments what we could see with the support of the rulers of this country and also the government authorities here.
Right. Can we know the website of Open Minds for the people who want to booking or who want to visit your center?
Sure, yeah. Our website is OpenMindsCenter.com. So if you put OpenMinds Center in Google, you can reach to our contact us page. We have both WhatsApp, telephone, and also the contact us page on the website, wherein the clients can reach us and they can book their appointment. And soon after they call us, we will be, our frontline staff will be more than happy to guide them with a listening ear and a supportive and empathetic approach. Of course, some clients, they will not be able to really pick up which professional they have to go.
Right.
And our frontline staff are very much trained to deal with such questions.
Dr. Shankar, I'm sure there is many people who support you. We can call your backbone from maybe your family or friends or the team who work with you. Today, if you have a thanks or message for them, what you will say?
Yeah. I would like to thank various people in context of this question. I would like to sincerely thank all my trainers who trained me to be a good psychiatrist with all the qualities enriched into the field of psychiatry. I would like to thank all my employers, and without their acceptance of me, I would have not really gained this experience to set up a center. And I would like to thank my family members, my parents, for giving me this sort of approach to my thought process. And last but not least, I would like to thank the rulers of this country for accepting the expatriates and the people like me, to set up a business with the help of the government authorities here. I thank one and all, and I thank God for giving this opportunity.
Thank you, Dr. Shankar, for your time. We wish for you, inshallah, to grow more and to be one of international center who start from Dubai. Thank you, and thanks for Open Minds Center.
Thank you so much for your team.
Thank you.